going to let Adie go ahead and start. We'll just save questions for after.
All right. So my thought today was to share a little bit about pneumatic compression pumps, and I don't know what you all know about those. They kind of seem counterintuitive for us to discuss because they would do some of the things that we do with our hands, but certainly not with the ability to interpret any kind of information learned because they're just machines. And we are, able to do a lot of understanding of what we are experiencing when we've got our hands on our clients. A little bit about me, I've been a massage therapist since I was basically in high school. And I now have a small private practice, worked in a hospital-based outpatient clinic for many, many years, both in physical therapy and in massage therapy. And I see people for mainly lymphedema long-term management in my home office clinic, if whatever you want to call it. And then I work for this company who you're going to see our logo a lot because I took advantage of some of our promotional materials to make this presentation. Eros Medical is one of the newer, smaller pneumatic pump companies. I really like this company because it's a very smaller, personally owned. It's not a publicly traded company, and it's practically a mom and pop. It's a bunch of relatives and best friends who run it out of Pennsylvania in the Philadelphia area. And it's been really fun working with these guys. I have been a preferred provider to S4OM for a number of years at this point. I've had some posters and conferences on various topics, and I've been very involved in advocacy for lymphedema. Some of those of you who may be dealing with the experience of the implementation of the Lymphedema Treatment Act, which has been a mixed blessing. It's a good thing in the long run, but it's been very challenging to get it up and going. I was, I'm somewhat to blame for making that happen because I was very involved in that. And I myself am a breast cancer survivor, and I have mild lymphedema. And of course, this information is really general. And please, I think it's an intimate group of us today. If you want to interrupt me at any point and ask a question, I'm happy to use, that method of conducting here. But remember that this is just general information. It's not specific to you, to your client. This is all stuff we're going to talk about that needs to be cleared with any potential users, provider before using. And again, please bring anything up that comes up for you today. So I'm assuming, and I may be incorrectly assuming, and please interrupt someone if I am telling you brand new what complete decongestive therapy is. Have you heard of complete decongestive therapy to treat lymphedema? It looks like I'm getting some nods. Okay, so it consists of the hands-on part that we do, the manual lymphatic drainage, the compression therapy, movement exercise, and skincare. I really believe that nutrition should be part of it, but it is not currently considered part of it. The compression care, usually what we're talking about is the multi-layer compression bandaging, and I think they're hidden behind this picture is hidden behind all our faces, but then progressing on to these garments that the patient with lymphedema would wear regularly. But it can also include this pneumatic compression pump. This woman is wearing a pump that treats her legs, and this is a LymphaPress product. Very good company. And then exercise, which, we if those of you who may be CLTs in our training, we're basically taught these really remedial exercises to pump our muscles against the compression. But really, as time has gone on, we've learned that just exercise in general is really important for controlling everything in our lives, but for controlling lymphedema. We used to be told not to exercise too much, and now we know within our capacity, it's important to exercise as much as we can. So you know that manual lymph drainage is that gentle pressure and stretch of the skin. How much pressure is one of those things that's always in question. We were originally taught, at least in my training, 15 years ago or so, that the pressure should be extremely light, like stroking a baby's head. That is no longer what we are being taught. But we do need that skin stretch to help the lymphatic vessels open the through the anchoring filaments, open the vessels to suck in that fluid that's in interstitial to become the lymph. And doing this therapy increases contraction frequency, helps to encourage the system to form new pathways and to move the fluid around areas that are obstructed due to trauma, surgery, lymph node removal. And it also helps reduce pain because when we get that fluid off of the internal structures, it's less aggravating. We tend to be more comfortable. And it promotes a parasympathetic nervous system response. So it's super calming. I find that people just relax so quickly with this kind of rhythmic, gentle pressure that it might be not what I want to do for some other massage clients. And so we've talked about compression therapy, including all of these different components, and it helps prevent the reaccumulation of fluids. It helps break up and soften fibrosis. And, as it says here, enhances all of our movement efficacy and is supportive and massaging in its own right. And the sequential pneumatic compression device, when I took my CLT training, I was told that these are bad, that we should not use them, that we should try to encourage our clients to only experience manual therapy through a therapist. And I push back against that because I can't have my client on my table every single day, all day long, and or whenever it is convenient to them. And so I want them to have strategies to manage things that come up. So it's similar to MLD and gives the patient that independence to just decide I need therapy now, and I can put on this garment that's easy to don. It can treat my head and neck edema if I've got a follow up from a head and neck cancer. It can treat lower and upper extremities. It can treat the trunk. And there's numerous ways that these devices are put together to address all these different body parts. But again, it can feel soothing. I've also had people tell me it feels like a very intense massage. So they might be on too strong of a compression amount. But most people tell me they really find it soothing and calming. Again, it enhances the motility, breaks up and softens fibrosis, and as I pointed out before, it can't respond to you saying ouch. It can't respond to noticing an area where the skin is breaking down. It can only inflate and deflate in different patterns that it's programmed to do. So, it's definitely not competing with us for the care of the client. Um, the device overview, basically, there's all kinds of devices on the market, and there are those that are intended to simply prevent us from developing blood clots when we're immobilized in a hospital type setting. And those are usually just squeezing, like one big chamber, squeeze and relax, and squeeze and relax. So they are not FDA approved for the treatment of lymphedema, nor are the ones that we can go to our local wellness center and experience the boots, they usually call them, that will squeeze for recovery after athletic involvement. Nothing wrong with those, but they are not FDA approved for the treatment of lymphedema. So we don't know if they have the appropriate sequences to help move the fluid from distal to proximal. Uh, Generally, when we're talking about those that are for the treatment of lymphedema, they're multi-chambered. They are designed to do that distal to proximal uh, inflation and deflation. There are different types of sequences, and I get kind of confused talking about peristaltic versus simply sequential, but they can work in different ways where they're relaxing and squeezing at different intervals to help with that movement of fluid. And of course, we want the most pressure further from the body so that we're just, creating that gradient. And I've seen them used in clinics. When I worked at Vanderbilt Medical Center here in Nashville, they did not want any devices being used by the physical therapy team treating lymphedema, or at least not these types of devices. Some other measurement types of of devices were used. But I always thought that was unfortunate because sometimes in that limited period of time, you have to treat a patient and get them in their bandages. Anything that you can do to maximize the time that you have with them can be really helpful. So I've seen them used very effectively in other clinics that I've visited. And I think this is kind of redundant. We've talked about
Well,
stuff already. Did someone have any questions? Okay. All right. So it can reduce pain and swelling, and by doing the swelling reduction, it can help prevent infections, um, reduce the frequency of those, improve blood flow. Wound healing has been shown in a number of studies to be enhanced. And I had my team at Eros helped me make this look a little more modern, but they didn't put in all my references. So I had some references, and there's a little bit of reference at the end, and I'm happy to send people references if you want to reach out to me. But it really can improve quality of life, and it can treat almost any part of the body. So I find that that is my biggest mission when I'm with my clients, more than providing soothing massage. My mission is to figure out what can I do to help this person have the highest quality life that they can have. So we have this limited period of time in the studio together, and then what can I give you to take away? Uh, and so these devices are sometimes key in that goal. You can use it with any kind of lymphedema, whether it's primary or secondary. I know most of us are probably most of the time dealing with post-cancer lymphedema due to radiation, surgery, even a cancer that is still there. Um, but it can treat all these other indications as well, such as chronic venous insufficiency and ulcers that result from that, and lipedema. So if any of you are dealing with those lipedema diagnoses, they're not going to have swelling if they don't have lipolymphedema. Their swelling is going to present differently than the lymphedema patient, but they still, even if it's not going to pit, they tend to find that their limbs feel heavy, that they notice that their ankles will swell at the end of the day. And they really love these devices. Most of my lipedema clients have a pump, even if they've bought them out of pocket, because they're not FDA approved for the treatment of lipedema, which is really unfortunate. A lot of controversy there. That's a whole other discussion. But you don't want to use it in the presence of an active infection that is not treated, so cellulitis. You don't want to use it with an active cancer, except in a palliative setting. And even then, that's, the conversation with the entire team. Um, Active DVT, definitely not. We want that to be healed in place or dissolved before we play with things that would squeeze and push. Um, Phlebitis, congestive heart failure was one of those things that was presented to me as like, oh no, never use it. But actually, I've never had a doctor say my patient can't handle it, but I've always cleared it with the physician before I've used any kind of manual therapy, anything when someone comes in with a congestive heart failure diagnosis. So I'm sure, you all are highly trained therapists. This is probably big duh to you, but, I have to go over it. And then any of these things where the squeezing could, oops, I want to go back just quickly, where the squeezing could just create problems. So a wound that's not treated, we could exacerbate it. We could move an infection through the system, very dangerous. So we just want to be, and of course, skin grafts, we have to be super careful about any interventions we do around those until they are um, safe, until we've been told that they're safe. And any kind of infection, whether it's an inflammatory condition that's not treated, we want to be careful with. So dermatitis, that's a broad term, but we want to be careful around that. Challenges with these things are they so I hate the word compliance, and I had gone in and tried to find other words because a patient chooses what they want to do, right? And person who acquires the device is going to use it as it serves them. But when I have my people with lymphedema that I'm recommending these for, I'm hopeful they're going to use them on a regular basis. But it can be difficult to get people to make a commitment. They can be a little bit difficult to put on and take off. Some of the brands, I feel like ours is very easy to do that with. But all of those little nuances that could make it difficult for the patient to be consistent with the use of the device, is unfortunate. There's a bit of a stigma. As I mentioned before, I was taught that they're bad. I don't agree with that at all. But, that was how I was trained, and I know a lot of my colleagues were trained that way as well. The technology has been zooming along, so it has been getting better and better in the 15 years or so that I've been a therapist. The devices are just phenomenal, and ours is a pretty high-tech device, and there's things that are much higher tech than what we have. So there's a lot of choice out there. We want to be really conscious of where the compression sleeve that attaches to the pump ends, because we don't want to create fibrotic bands at the superior aspect. Now, this is something that is not described in the literature. When I went looking for information about it, studies that had shown that this happens, I could not find them. However, I've certainly had the patients come to me and say, I developed a lot of swelling right at the top. So we have to think about, when we're helping a patient choose one of these devices, what is the garment going to cover? And so, we often want to cover the chest, and if it's the arm, and the abdomen and pelvic area, if it's the lower extremities. So we have to be conscious of all of that, not to create swelling problems in other areas that we didn't have swelling before. And that's usually doable as long as we think carefully about what to choose. And then insurance coverage. And this presentation was originally put together for a Canadian group. So I talk about Canada here, but I'm aware that in Australia and other countries around the world, it's just different what insurance will and will not cover. So we have to think too, I think for those of us who are in a position where we're going to be recommending these devices, um, we may just be in a position where we want to make a client aware that these things exist. But if we're going to be helping them work with their providers and their insurance to get them, it's really helpful to know a lot about the different brands out there. Because if someone is not insured for the device, for example, my lipedema clients, our device is quite a bit less expensive to buy privately than most of our competitors. And that can be really helpful to be able to share with the client, because sometimes, even if they have insurance, their co-insurance is more expensive than the out-of-pocket to buy our device outright. So I like to try to keep track of what all these different things are and what they cost. But ultimately, the client has to know their insurance if they're going to get insurance coverage. And yeah, I mean, even in Canada, I think that the vendor has to have an agreement with the insurance plan in the province for them to be able to get the device. So it's tricky. Yeah, unfortunately, it's tricky, but they always require a prescription from the physician. So that part is, if it's going to be the FDA approved for the treatment of lymphedema device, it must be prescribed. And I've never had a physician, when I've told a client that I thought they would benefit from the device, never had a physician balk. Lymphapress, I mentioned earlier, is a much larger company, and they've done some amazing studies. I'm so grateful to the work that they've provided to the community. They built this garment that you can kind of see through. And if you're familiar at all with the indocyanine green studies that have been going on, this is a dye that is considered non-toxic to those who don't find anything that you're injecting in your body to be toxic. But it binds to proteins, and it's fluorescent. So when you look at this indocyanine green under fluorescent light, you can see how it is bound to protein. And the value of these see-through pumps will be shown here in that you can watch it pushing this bolus of lymphatic fluid. So lymphatic fluid is protein and fats and cellular debris in a fluid basis. And people have in the past talked about how these pumps only move the water. Well, we can see that that's not true. It's squeezing, and if you can see that bolus moving, that's water plus, because the indocyanine green is not binding to just water. So I found this to be like, oh, so wonderful to be able to see this. And I'm so happy to share it with you. And it's on YouTube, so it's really out there and available. Again, I had a reference here for what this study was, but this 5-year study that looked at all of these different responses that this large group of lymphedema patients had to the use of the device showed so many benefits in reducing in cancer-related and non-cancer-related lymphedema, cellulitis, hospitalizations, health costs, outpatient visits. It just gave people so much autonomy and better outcomes. So, once again, I say ha to those people who told me that the devices are not a good thing. And then there's a lot of mythology out there around these devices that they would potentially worsen the condition, and that is not shown in the literature at all. That they would cause those fibrotic bands I mentioned, again, not in the literature, but I have heard reports of it. So I think that's possible. That if you just pump the legs without anything on the pelvis, that you will automatically have genital edema. And that is certainly not true. I have definitely seen that happen, but it's been a rare case, not the frequent case. And that they're difficult to use. Honestly, usually they're set up, you put on the garment, you have your pump handy, and you push a button. That's it. Our devices will suck the air out when the program ends, so they really just slip right off and roll up small to fit in a little roll-on bag so you can take them traveling. They weigh 6 pounds plus the garment. So um, that they shouldn't be used in conjunction with the complete decongestive therapy. And I debunked that earlier. I think that they can be a useful tool, that they shouldn't be used with wounds, but actually there's a lot of studies out there showing that they enhance wound healing and that they move only water and not the other parts. And we just saw that that's not true. So I
Can I
won't go
ask a
through.
question, Addy?
Yes, please.
Sorry, could you go back to the other slide?
I can.
So in the contraindications was open wounds, and
Uh-huh.
then you're also saying it can help with wound care, which makes sense to me. So how does that work if someone has a wound and you want to encourage wound care? What's the way that you do that?
Yeah, so treated wounds that have been dressed, that are appropriately treated. Um, I think, I am not a wound care specialist, but I think that the point is that wounds are addressed and treated, and that you don't just go, oh, I just noticed that I have this wound and it's oozing, and I'm just going to go put my pump on. Does that make sense? Did I answer your question adequately?
Let me make sure I'm understanding. If the wound has been properly dressed and is already in the healing process, then these can accelerate that.
Yeah, I mean, I think that if a wound is treated and properly dressed, then it is in the healing process. That's my understanding.
Okay.
So it may be early in the healing process. I would
Like
never,
you don't have to do it like only proximal of the wound, let's
no,
say.
no, you don't. Actually, so some of the devices have more ability to turn chambers on and off.
Hmm.
Um, and I have been told, I have not dealt with this personally in my practice. I've been told by many of my colleagues that they will sometimes turn off a chamber that's going directly over a wound just
Hmm.
to not be aggravating it, especially if it's in a fragile state, but that they use the devices anyway. And I've never heard anyone say that they only did it proximal from the wound. So I think that it would really depend on the individual and the individual wound, but these venous leg ulcers tend to heal much more rapidly. So those venous stasis ulcers have been shown to heal more rapidly. If you want more information about that, I can probably get you in touch with someone who's like a wound care, Frank Avila's or someone like that would probably have much more detailed information. Brian Grollo are some of the people who do training on the use of lymphedema therapy in the setting of wounds. But I've certainly treated people where I have bandaged over treated wounds, over treated ulcers. And that would indicate that this would be safe as well. But they have to be treated and contained. And, you know, we don't want to bust open any skin that's starting to close. So all of this is general information and specific to a client. Like I would never unilaterally make a decision about how to treat a wound without consulting with the wound care specialist or the physician.
Yeah, thank you. Thank you for that. I did have a client who had an open wound in the center of her chest after some tissue removal that
Yeah,
wasn't closing, and they actually used a pumping device to help
yeah.
that close. But that would be a different kind of device than like a lymphedema device, I'm
Sounds
presuming.
like you're
So,
talking about a wound vac. Do you think that that's what it was?
yes, yeah.
Yeah. So that's a negative pressure device. And that would be more similar to like automated cupping than it would be to this, which is a positive pressure device, right? So this is squeezing and that's sucking. And
Mm-hmm.
um, but I suspect that once that wound, and I've had people with wound vacs pump around them. So now I'm trying to think of how Deanna did that, but I have this one client who has been through that. And she felt like the wound vac plus the compression pump really made a huge difference in getting her healed up after a surgery. So,
That
you know,
sounds complicated, but so cool.
yeah, it's cool and it is complicated. And that's definitely outside my personal realm of experience because as a PTA, they didn't want me doing wound care. So
Thank you.
anyway, yeah. Any other questions on that or anything else? Because I'm almost done here. So, all right, let's see. What did I do now? Will you move? Okay. So I'm just going to talk really quickly about my clients because my clients are lymphedema oriented in general. And basically they all love their pumps. They all wish that they were easier to travel with. Um, that's a huge thing. And there is a pump out there that's not pneumatic. So pneumatic means it's air filled. And there's a pump out there called the Koya that has these super cool fibers that contract. And so it doesn't need air and it just needs power. So therefore the patient can wear a little power device around their neck and the fabric itself will squeeze and relax and squeeze and relax. When I tried it on at a conference, I didn't feel like it did that much. Felt like my compression stockings were probably doing about the same amount. But I find it hopeful for the future because we want our people to have everything they need to have the best quality of life. And so I think, you know, these breast cancer patients and Larkin, this ovarian cancer patient, all feel that they would not have the same quality of life if they didn't have these devices. And they've all tried different brands. They're talking about ours in this particular uh, interview, but I think, you know, overwhelmingly what they're saying is that we love them, but they're hard to travel with. And that's all I have for you. So what did I not talk about that people are interested in?
Addie, I have a quick question. Do
Yes, ma'am.
you like, are your clients already prepared and knowledgeable on like stimulating like regional nodes before doing the compression to kind of receive and process?
So yes, I would say I don't know where that came from. Um, I would say that overwhelmingly my clientele now is people who are in maintenance phase. So they're not they've completed decongestive therapy in a hospital-based clinic or, some with someone else, because I just don't do that anymore because of the frequency that's required to do it. And so they're very knowledgeable about self-manual lymph drainage. I do advise them that they will get a better result if they do some preparatory lymph drainage. But some of the garments, like our Arm Plus garment, does treat through the whole ipsilateral chest. And the most recent studies are showing that that's where most of the drainage goes. Even after all the interventions, most of the drainage in upper extremity lymphedema is going to the ipsilateral axilla, which we were taught not to touch during our training because we would exacerbate it. But that's not what, now that we have indocyanine green and they can watch it happening, that's where it goes. So yes, we definitely stimulate there and definitely try to educate best practice. So I'm curious who has seen these things or if we have any other CLTs on the call. No?
I saw one probably 14 years ago, 15 years ago, one of the first ones.
Yeah.
And they brought one to our practice and trained everybody how to use it and said if the physical therapist or doctors call us and want to have their patient try it, that we could do that. And we didn't charge them,
Yeah.
but and we thought it was great. Everybody loved it, but they're so much better now. These are much
And if it
more,
was 15 years ago, it wasn't even one of the first ones because they came out in the
yeah,
70s. So, um,
yeah.
but
And
yeah, they are so much better.
yeah, I just thought it was odd that the company was like, can we just have a room to put this in and train all your people because they couldn't get any of the, well, if they could, they couldn't get one hospital to do it or all the hospitals to do it. And hospital rooms are more dear. So
Yeah. Yeah.
yeah, so I have seen it. And I don't know if we have any CLTs in here, but I think a lot of us have had some MLD training.
Yeah. Yeah. So, it's not something that you need to, I'm glad you know about it. It's not something that you ever need to tell your clients about, but you might see somebody who you're just going, wow, that is really stubborn lymphedema. And at least um, I think there's so much lack of awareness in lymphatic health, that physicians don't know what lipedema is. Many
Right.
don't know what lymphedema is. I'm still having breast cancer clients come to me who've been diagnosed in the last year who say that no one told them about the risk of lymphedema at the time of diagnosis. I find that just terrifying. I mean, this is at
Yeah.
this point, most of us with breast cancer aren't going to have a huge risk of lymphedema, but all of us are going to have some risk. And, we're not having radical mastectomies in the way that, like, the women that I started treating 40 years ago had just like so much tissue removed and they had these giant arms and they were developing infections in their arms. And it's just not done that way anymore, but it's still a risk. And the science around it, like Dr. Stanley Roxon, who is out of, oh, I'm blanking on the name of the institution in California, Stanford. He has postulated that people who develop secondary lymphedema after a cancer or a trauma have a, a tendency toward lymphedema, an occult primary lymphedema waiting for the assault that will tip it over the edge. And so our doctors can't know who that patient's going to be. They can do, I mean, I don't think at Vanderbilt they do a lot of lymph node mapping before the surgeries, but they can. So there's ways to super minimize this risk, and I think doctors are doing a better and better job. But for them not to make a patient informed, to me, is just that's wrong. It's just wrong. But I will say that when I got my diagnosis, I got handed a little pink bag and it had a little piece of paper in there about lymphedema. And I came home and put my little pink bag behind the bed and I didn't look at it again for a year. So, it is possible that some information is going mixed, just not missed, just to be fair to the physicians.
That sometimes I think that the patients are getting so much information
Mm-hmm.
at the very first that it's a lot to take in.
Yes.
And that, yeah, sometimes I think, well, that's not yet, that's not now, that's later, or I don't have that.
Yeah.
And yeah, I think they put it aside and forget about it sometimes.
Yeah. Yeah. So I think that's where, we can be offering a huge service to people is recognizing signs and symptoms, being able to hear someone say, my arm just feels heavy. I'm getting this pins and needles sensation. That is sometimes before there's any swelling. That's what people report. So it's helpful for us to be able to say, have you gotten any information on lymphedema? And maybe know where you can refer your people, but also to possibly just talk to their physician about the benefits of the pump. Now, to get insurance to cover it, generally the patient needs to have gone through CDT. If it's for lymphedema and insurance is gonna pay for it, they're gonna want to see a month of conservative care. So it's not by itself. It's just another thing for us to know to help offer information. I probably have a tendency to be more of an oversharer. Like I really want to tell people about what's out there. And I do recognize that sometimes we have to be very sensitive to what a person's capacity is to hear, because it is so overwhelming when you get a cancer diagnosis. And having been there, I know exactly how that is. But I've always been grateful to the people who come forward with information to me. And so I try to figure out how to sensitively provide that service to others.
Yeah. I think of massage therapists as early warning systems. And while you mentioned the pins and needles and my arm feels heavy, are there any other subtle things that you think massage therapists that maybe are not trained CLTs could notice and use to refer?
Now, certainly any pitting edema in an
Mm,
area that hasn't had a very recent surgery and hasn't had a contusion or some kind of trauma. Pitting edema would be something that is definitely something we want to ask them to bring to their physicians. Any
mm,
weeping, which usually only happens when they're very swollen or have been swollen for a long time. But I've seen a couple people where it's like, I don't even notice that they're swollen, but somehow their skin is, okay, shiny skin, tight, shiny skin, you know, somehow even though
mm.
they don't seem swollen, they've got that tight, shiny skin. It's very fragile.
Yes.
So, but the pins and needles and the heaviness are two things that are cited as specifically early warning signs of lymphedema.
Hmm. And were you a physical therapy assistant before you were a massage therapist or a massage therapist first?
Birth massage. I started doing massage
Okay.
in the 70s and then in the early 2000s I decided that I wanted to do massage in a hospital setting. And that was not a possibility here. But becoming a PTA was a 2-year degree and I felt like I could do that even though I was 50. And so that's what I did. And I wanted to
Yeah.
work at Vanderbilt and I identified all that and I just sort of put it together and made it happen.
Yeah. That's wonderful. And for massage therapists out there, shouldn't they look for LANA approved programs to get their training through?
Yes and no. So
Okay.
in general, LANA is a great organization. And when I was deciding to be a CLT, I wanted to make sure that I could go on to get that level of certification. But LANA made some changes during the pandemic that some
Mm,
of the schools have decided not to comply with. I think the changes are fine. I was actually, full disclosure, I was on the board at the time and I voted for these changes. But one of the great schools, which is close training,
mhm,
decided not to comply and they didn't
right.
care. Gunter just didn't care if they were able to be LANA certified because it would have meant restructuring his program again. And I find that sad and unfortunate because I respect and love him so much. And I think that some of the best therapists I know are close training therapists. So that's why I say yes and no.
Mhm,
You might decide that LANA certification is not as important as getting your training through close, but there
mhm,
are other good programs out there. I
right.
have some that I dislike, and I'm not going to mention those. But I do like Monarch, which is
Mm,
it's run by a massage therapist PTA. So
yes.
it's very friendly to massage therapists, and you can take your CLT in chunks from Monarch training, like do your MLD and then do your bandaging, and you don't have to do it all. Like I had to do everything in 10 days away
Mm,
from home. So, but you don't have to do
that's
that.
comfortable or
Yeah.
more comfortable for some people. Yeah.
I think for a massage therapist, Monarch is a really good choice because they really understand the subtle differences of our practice to a PTOT practice.
Yeah. And Audrey has a question.
Yeah, I've been looking into getting like the CLT certification and was told like massage therapist only PTs and OTs can bill for compression for doing the bandaging and that. And so it was like, do I want to take that? You know, I'm not in private practice, and there are PTs and OTs where I work that also do lymphatic drainage. So I'm like, maybe I should just stay in my lane, you know, and if I did private practice later, maybe adding that in, and just doing the manual therapy training. Right now, do you have any thoughts on that? Any
Yeah,
input for me or us? Yeah.
I mean a little bit. So it is tricky that I do recall that was part of the reason that I went to be a PTA was because
Uh-huh.
the limitations of what I could do in a hospital setting if a
Yeah.
hospital even hire me were going to be, profound. Um,
Yeah.
as a PTA, I never had any pushback, even though in that world you will hear comments that it's difficult to bill for a PTA services, but in a hospital-based setting, never any problem.
No problem. Yeah.
But I do think that if you do not have a private practice and that's not your goal right now, you might be
Mhm.
better off just focusing on improving your manual lymph drainage skills. If you're
Mhm.
not MLD certified at this point,
Mhm.
you can do that. Um, I think most of the training schools, if not all of them, will offer that. And that's more like a 45-hour training.
Yeah, yeah. Mhm.
And then you can add the bandaging at any time. What I will tell you is I don't do much bandaging anymore because
Okay.
I'm older and I have osteoporosis and it's very
Oh,
physical, very, very physical. And
yeah.
so that's another thing to think about. Like I used to love to crawl around on the floor and put some 100-pound leg on my shoulder and do the bandaging. And it was so creative and I loved
Yeah.
it.
Yeah.
And I would really hurt myself badly to do that now.
Yeah.
So those are some of the
That's
things.
good advice. Thank you.
Yeah. But I will also just add one thing, which is that I
Sure.
do occasionally with an upper extremity do CDT at home in my
Okay.
little clinic that you can't see behind me. And and I just charge privately and I've never had anybody balk. I mean, some people just flat out can't afford it. And
Right.
help them find another therapist.
Yeah.
But But those who are fine about private pay with me, I've never had anybody balk about the fact that they're not going to be able to bill their insurance for the part that's not manual therapy. Some of them, they take my bill with the codes on it and they submit it and they get reimbursed. So. And I use Massage Book, which gives me a nice receipt for them and works fine.
I was to let you know that Danielle is here from Italy. Glad to see you, dear. And Ama from California. So,
Yay. Wow.
yeah.
International crowd.
Mm-hmm. This is great. And I think Kim is from California too, so you may have some help.
Great.
Yeah. Hi. Hi, everybody.
Yeah, but Adie, that was a really good presentation, and general is good, really and truly. Yes, because we need that general information before we go farther with it.
Yeah.
And you know, there there's always time to learn.
Yeah.
I'm a lifelong learner. I think most of us here are lifelong learners, and so we really do appreciate your insight on that too, because you're obviously a lifelong learner as well.
Yeah, it's fun. I mean, it's great to keep our brains engaged. And also, we're living in a time where technology is revealing so much. So much of what
Mhm.
we assumed was happening with manual lymphatic drainage, for example. It's not
Right.
the way we pictured it. It's not that it doesn't work, and even the super gentle, types of touch
Hmm.
are beneficial, but the way that touch affects lymphatic fluid is different than what we had understood before we could see it in action. And I find that
Right.
just incredibly stimulating.
Right. Exactly. Do you think that now there's more opportunity for massage therapists to be in the hospital,
Well,
or more opportunity in the community to serve those that have had a medical adventure?
I think there's definitely the second point. In the
Okay.
hospital, I think is so dependent on where you live and the value system of the individual hospital. Um,
Hmm.
Certainly, the cancer team at Vanderbilt wants inpatient therapy. I would say that probably the orthopedic teams want inpatient massage therapy as well. But getting the giant corporation. I mean, it's a huge corporation here in Middle Tennessee. Whoever's in the decision-making positions there, however hard I worked on it and however internal connections I made, I was not able to help start that program there. And that was one of my goals when I started working in my second episode there. Now, granted, we had a pandemic, and it was shortly before the pandemic that we started this push. So everything went off the rails during that period of time. But I think there's desire among patients for hospitals to offer that. And that
Hmm.
that drives, I mean, Carolyn was very helpful in me understanding how to utilize what patient desires are at hospitals. But I think that any of us can go to our hospitals and try to implement it. I think when patients get what they want in hospitals, hospital revenue goes up. Revenue going up is what management wants. And having a patient choose your hospital because you have those ancillary services over the other hospital in the community because they don't, those are strong arguments.
Right. Yeah. Are you seeing that most everywhere in physical therapy is having trained people in uh, complete decongestive therapy?
Sadly, no.
Oh,
Sadly, there are still physical therapy clinics that offer lymphedema therapy with therapists who are not CLTs. Um, I think that the there's also a trend in fashion, for lack of a better word, to do something called lymphatic massage that is actually cellulite massage. It's not lymphatic massage. It's very aggressive. And so there's a misunderstanding about what manual lymphatic drainage is as opposed to this body sculpting approach, which
Mm,
I mean, I used to charge people back in the day a fortune to come in and do the aggressive cellulite work, and they would moan on the table. And I did that for a couple of years and went, I don't like hurting people. That does not make me happy. And they pay me a lot of money, and I don't think they really got the results that they were looking for. So I'm not a fan of that.
yeah, I'm not a fan of using those two words together, lymphatic massage, unless you're going to do a massage and add some lymphatic techniques into the work. But
Yeah.
yeah.
But there is that trend, and it's definitely out there. I mean, I actually was interviewed for Vogue magazine about
Mm,
that. And I just
yeah.
remember being like, ah,
Yeah, this would not be recommended for cancer patients or people with lymphedema or lipedema.
no. I mean, people with lipedema now can
Maybe.
deeper massage. And some of them, when they get past that initial hypersensitivity to touch, they can really benefit from deep work. And there's a technique called quadrivas that some of you may have heard of that I wasn't aware of, but it's a very aggressive, deep tissue
Mm,
kind of massaging. And there were some studies in Europe on that. And Daniela, you might be familiar with that, where they found that lipedema patients had good results with this very
mm,
aggressive kind of body work. So again, everybody's unique. And I don't want to do that personally, but I do find with my lipedema patients, a lot of fascial release is useful. A lot of deeper techniques than I would use on a lymphedema limb.
right. Yeah, Addie, I really appreciate your time. All of us appreciate your time and wisdom today. Uh, are are you teaching classes, continuing ed for massage therapist, or are you focused on doing some research? What's up? Are you
So
just you're
I
just
work
busy?
I'm busy. I work with Eros Medical, as I mentioned earlier, and I really get a kick out of this group because they're very dedicated to their patient population, um, and in the context of that, I'm doing some speaking at a couple conferences, but
Okay.
and with hands-on workshops. But I'm not offering CE courses, and maybe that might be something in my future. It would be fun.
Okay. Yeah. Does anybody else have any other questions for Addie? No?
I just want to say thank you so much for your time and sharing your experience and expertise. And also, I'm so happy to hear what you said. Like for years, there's been this question, and I ask it at every conference in the right class. Like, should we be pumping the axillary if that's where the compromise is? And I've gotten so many answers over time. Bye, Audrey. I've gotten so many different answers, but I'm so happy to hear that this green dye is finally showing that that's where the fluid is going and that we really need to pump to the nodes that are still functional.
It's incredible. And, I suspected that because I found that for myself, that was the spot. Like when my arm got swollen, when my trunk got swollen, that was a spot that calmed it down. Doing all the other rerouting stuff didn't seem to do anything. But it is a group out of Australia. And if you want to shoot me an email, I can put my email in the chat. But if you want to shoot me an email, I can find the name of the group because it's out of my head right now. And Dr. Louise Kohlmeyer and Dr. Hiromi or something like that. They have been doing all these studies in vivo with women with different kinds of lymphatic dysfunctions. And they've been trying to find what those pathways, those actual drainage pathways are. And they've kind of debunked the idea that we drain down to our groin. It's very rare that that happens. So, and it's very little fluid going across to the other side. It's really like a giant percentage, like 78% or something, is draining to the ipsilateral axilla, even in cases of full axillary node dissection. So,
Wow.
yeah, Isn't that interesting?
Mm-hmm.
Yes, thank you so much for that.
Yeah.
It's just reaffirmed this, I guess I've seen some benefit and I've in my brain and understanding like there are still functional tissues there.
Yeah, the arm would
Anyway,
blow up.
I've been judged otherwise in moments, and so I feel whatever the right word is for that, but I would
Yeah.
love to see those studies. So thank you for the names. What was the other one? Dr. Swami.
Hiromi, Hiromi, something like that.
Okay,
I'm
close
probably
enough. I'll
wrong
find
about
it.
that. But
Yeah.
Louise, Kohlmeyer, I think is how Louise spells her name. But yeah, it was like mind-blowing stuff when it first showed up in the conferences.
Thank you so
Mhm.
much.
Yeah.
Yeah. Thank you so much,
Thank
Adie.
you.
We're so happy we got to have you with us today.
And
Thank
thanks,
you.
We know
Zerlin.
your time is
Thank
precious
you.
and we appreciate you
Yeah.
working with all these amazing humans because you're an amazing human too.
Well, I appreciate y'all doing it too. They need us, and it's nice to be able to offer these services.
Hmm. Thank you so much, Adie. And thank
Right.
you everybody for being here. I'm so glad that so many of you made it. And go forth and have an absolutely lovely rest of the week.